Hello everyone, this is Dr. Paramjeet. How are you today? And welcome to my channel. And this segment of my channel will be discussing about infertility, male, female infertility issues, low sperm counts, and what can you do about it, how common it is, and how you can actually overcome it, what are the causes of what are the reasons? What are the causes? What are the lifestyle issues which cause infertility in both sexes? And what can you do to prevent it? So, today's video will be discussing about low sperm count. So, we'll be discussing what might be the symptoms of low sperm count in males and when should you see a doctor? What are the general causes of low sperm count? And what medical conditions can cause low sperm count and how environmental factors like radiation and heat can actually affect your sperm count and what lifestyle changes can actually lead to a low sperm count. So we're going to discuss many things including risk factors, lifestyle risk factors which can affect your sperm count and even the complications of sperm count and prevention of low sperm count will also be discussed today. So if you are interested in this topic and you're looking forward for good quality information, then you don't have to go anywhere else. Our channel provides quality medical information directly from international US medical library. It's not something from my point of view. It's basically researched factual information which I'm sharing today. So let's discuss about low sperm count. So don't forget to subscribe my channel, Doctor Education, and if you haven't yet, press the bell icon. And if you don't get notification of my videos, then you must press the bell icon, and then you'll get a notification of all my videos whenever I upload them, and I upload them on a daily basis. So don't forget to do that.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So let's talk about low sperm count. What do you understand by a low sperm count? Low sperm means that the semen, the fluid which you ejaculate during orgasm, contains fewer amount of sperms than normal. So a low sperm count is also called as oligospermia. That is uh, less amount of sperms. There is another term called azoospermia, which means there is no sperm at all in your semen. When is your sperm count considered low? It is considered low if you have less than 15 million sperm per milliliter of semen. So 15 million, less than 15 million sperms per milliliter of semen is low sperm count, and having a low sperm count decreases the odds that one of the sperm will fertilize your partner's egg, resulting in pregnancy. Nonetheless, good news is that many men who have a low sperm count are still able to father a child. So let's discuss about the symptoms of a low sperm count. How will you know? So the main sign of a low sperm count is an inability to conceive a child, and there might be no other obvious signs or symptoms in some cases, but the underlying problem which is causing the low sperm count, like an inherited chromosomal abnormality, genetic problem, a hormonal imbalance, a testicular, disease, can actually cause symptoms, and that those symptoms can vary, and those symptoms can vary from problems with sexual function, for example, a low sex drive or difficulty in maintaining an erection, erectile dysfunction, or even pain and swelling or a lump in the testicular area. And it can be very vague also, like decreased facial or body hairs or other signs of hormonal or chromosomal abnormalities. And so, when exactly should you see a doctor if you suspect that you have such issues? So, first of all, if you are unable to conceive a child after a year of regular unprotected intercourse, then you should see a doctor. If you have ejaculation or erection problems, if you have a low sex drive, Other problems, sexual functions like pain, if you have discomfort or a lump or a swelling in the testicular area, if you have a history of testicular, prostate, or sexual problems, if you have had a surgery in the testicular or penis or scrotal area or in the groin, or if you have had a treatment for cancer, you can see the doctor before even trying to conceive in such situations. So let's now discuss how and what can actually cause a low sperm count. See, the production of sperm is a complex process and requires the normal functioning of the testicles as well as your pituitary gland, the hypothalamus, as well as your hormonal glands, especially the pituitary gland and the brain, some part which is called as hypothalamus. This organ in your brain produces the hormones that trigger sperm production. Once the sperms are produced, the testicles and the delicate tubes around the testicles transport them until they mix with the semen and are ejaculated out through the penis. The problem with any of these systems can affect your sperm production. Also, there can be problems with abnormal sperm shape and even the movement or the function. However, often the cause of low sperm count is not identifiable. That's the problem. But if it is identifiable, then a medical cause of low sperm count can be something called as a varicocele. Varicocele is a swelling in the veins of the testis, and it is most common cause and most common. It is the most common reversible cause of male infertility. Although the exact reason why such varicoceles cause infertility is unknown, but varicoceles do reduce the quality of the sperm, and it might be related to the abnormal temperature around the testicular region, and which might lead to sperm dysfunction. Another reason why your sperm count can be low are infections. Infections around the testis and in the pipelines of the testis, including sexually transmitted infections like gonorrhea, HIV, or other infections or damages or even trauma to those areas can cause problems. Then other reasons like ejaculation problems, like sometimes retrograde ejaculations occur when the semen enters the bladder during orgasm instead of emerging out of the tip of the penis. This retrograde ejaculation can be caused by various health conditions. Sometimes it is caused due to spinal injuries, due to surgery in the bladder or prostate or urethra, or sometimes even due to diabetes. It can be caused because of neurological problems, because it's basically a very subtle effect. Ejaculation is a process where one part contracts and the other relaxes. If the other one does not relax, this contraction will push it backwards. So that's the idea about it. Now, this ejaculatory problem can also happen due to some medications such as blood pressure medications, especially something called as alpha blockers. And many of these ejaculatory problems are reversible and some are not. But in other cases, if ejaculatory problems are there, then the quality of sperm are good. Then the sperms can be directly retrieved from the testis and you can be helped.